We're going to start off the tour with the eye. Now this eye is a little bit different than these eyes here. These eyes here are smaller and they do have the QR code so you can see everything in here. The problem is they're really small. So there's probably going to be some external stuff here and maybe some internal stuff, but my favorite model is this larger one because you can see everything in greater detail. The structures are all exactly the same, just different in size. The only difference is this model also has the lacrimal apparatus and the nasolacrimal duct and sac, okay? So I'm gonna go ahead and start with this one since it's different. So this is the eyelid. You guys remember orbicularis oculi? All right. So we're gonna go over here and you guys see the red clay here. That means in the past I had a pin here. This is your lacrimal gland. Now, do you know which eye this is, left or right? It has to be left because the nasolacrimal bulb and duct go towards your nose. You guys know that your nose is medial, right? So what that means is your lacrimal gland is going to be superior and lateral. And it releases the tears here. And when your eyes blink, they don't blink straight down. They blink from lateral to medial, pushing the tears both down and towards your nose. Okay, so notice when you're crying, you also get a stuffy nose. Why is that? Because the dried mucus in your nose mixes with the tears and gives you boogers, right, that you have to blow. So this is the lacrimal gland. Lacrimal ducts are the little tiny green things that you see right there. Then the green over here are called nasolacrimal ducts and nasolacrimal bulb. You may also see some other terms for this, but nasolacrimal ducts is the main one here. This is the peduncle, but I don't usually test on that. It's a weird name. It's that little corner of your eye. But there you go. This is the eyelid, and by the way, this is likely to be a separate station. So be aware that the lacrimal gland, eyelid, and nasolacrimal duct and bulb are going to be a separate station. So be ready for that. Okay, moving on to the eye itself. It looks like one of the pieces has fallen. I need to get some super glue going. But what I'm going to do is I'm going to start with this piece here because this is the superior portion. This is normally the main one that I ask for external stuff. Okay, do you guys remember the term that I said? It means a muscle going straight down the middle. Rectus. Rectus, okay. So these are the rectus muscles of the eye. Now these are muscles, but I told you to skip them because we were going to include them in the special senses, which is this. Okay, if this is on top, what would the name of it be? Since you guys have already finished your lab, right? Superior rectus, right. So when that one pulls, your eye lifts up, you look up. Now here's an interesting factoid, not really directly related to the tour, but do you guys know these muscles are what are called fast twitch muscles, and they don't have the ability to pull and hold. Now if you guys want to do a quick little demonstration of that, here's the experiment. Look straight ahead. Now don't move your head, but look up and try to hold your eyes up as long as you can. Keep your head straight, but look up. And after about 15 seconds, oh, it hurts really bad. Now, why is that the case? The muscles of your eye, the rectus muscles, are fast twitch, which means they're meant to move quickly. But then what does your head normally do when you look up? It tilts up so your eyes can go back to relaxed, right? So the idea of moving your eyes and keeping your head still is not something we do. So these are fast twitch. They can't pull and hold like the muscles of your lower back do, right? Those are postural muscles. So this is the superior rectus for lifting your eye superiorly. And then we have the two side ones. Now, if this is the left eye and we're looking down on it, which one is medial? Here. The other way to know it just from this is the slight tilt of the optic nerve. Now remember, the optic nerve crosses, if you guys remember the brain, optic nerve crosses right in the center. So it means the optic nerves don't go straight back. They come back at an angle medially inflected, okay? Medial inflection towards this, towards the optic chiasm and then back to the lobes, the occipital lobes, which interpret vision, okay? So superior rectus, lateral rectus, medial rectus. A couple of other things. This is the beginning of the superior oblique muscle. They just don't show it very well. The oblique actually rotates your eye, twists it slightly. So instead of up, down, medial, and lateral, it actually turns it slightly so you get everything straight up and down. Now, the white of the eye is called the sclera. It's called the sclera. And the outermost part of your eye, the clear part, is called the cornea. And that is the part that is changed when you get a radial keratotomy or LASIK. They slice that, change the curvature of it, lay it back down, and now you have proper curvature and you don't need glasses or contacts. Okay, so that is it for the superior part of the eye. All the same structure you're going to see on the small one. Notice it does have the QR code so you can key everything out. If the key says something different than what I said, that's fine, or you can superimpose what I've said verbally over what it says there. Part of the problem is a lot of these models come out of Germany, and so some of the terms are a little bit more Eurocentric rather than Americanocentric, if that's a word. So that's why some of the terms differ, and anatomists can never seem to get on the same page with the names of things. I don't know why. Okay, over to the main part of the eye. This brown area here is called the choroid. You guys remember the choroid plexus? It just means colorful. So because it was the most colorful part of the brain, the choroid layer here, you can see blood vessels all over it and nerves. So that's the brown. Okay, looking at the front of the eye, you can see the beginning of the sclera is the white again. Now, anybody know the name of the colored portion of the eye?
Iris.
Iris. Now the question is, what evidence is, just from looking at this, that this was made in Germany? Blue. Do you realize that about 80 to 90% of people in the world have brown eyes, and yet they chose to paint them blue because this was made in Germany, which is full of blue-eyed people. Interesting little side note. Okay. So the hole in the center then is the pupil. This is what actually enlarges or shrinks to allow light in, but it's the iris itself that is the muscles that control the pupil. So in bright light, the muscles, the circular muscles contract, making the pupil smaller, and in darkness they relax and the radial muscles pull, opening it up. And if somebody has inappropriately sized pupil, that means either drugs or injury, right? And those two things are what cause inappropriately sized. And fixed and dilated is not something you ever want to hear, right? Because that means that the reflex centers in the brainstem that control the size of the pupil are not working. And that's the very core of your brain. And if your core of your brain is not functioning properly, that means the rest is also not functioning. Does that make sense? Fixed and dilated means that your brain is not functioning properly. All right. So I think we did most of this. The only thing that's left over then would be, and we have the whole bottom half. For this portion would be the inferior rectus, and you can't really see the inferior oblique. So that's pretty much it for that. And the last piece is going to be, I'm just going to set it back in here, is going to be the remainder. Okay. This big blob here is hard in the model, but normally it's jelly-like. It is what's called the vitreous humor. Vitreous means jelly-like, and humor means stuff that we don't really know what it does. And that's what they call it. Now, interestingly, this forms once in embryonic life and stays with you forever. And if little chunks end up getting stuck in there, it makes you see what they call floaters. So this stays your entire life. You get one of these. Okay, looking back inside the eye, we have the lens. Now, the lens is not the main structure that changes the direction of light in your eye. It's the cornea that does that. But the main job of the lens for you young people, and not for me, is to change its shape to help you see things up close versus things far away. Now, when you're seeing things far away, the lens is flatter to bend the light rays less. And when things are up close, the light rays are diverging more, meaning you have to have a fatter lens to bend the light rays more to make it hit the back of your eye properly. Now, as you get older, past 40, the ability of this to fatten or flatten gets diminished, and so you need glasses. Now, if you're a young person wearing glasses, that means the length of your eye is not correct, and LASIK would be a good choice for you. But when you pass 40, you need reading glasses, or for me, bifocals, because my lens does not bend. The way to think about it is if you guys have ever found a gummy bear under your seat in your car, it's hard as a rock, right? You can't bend it, but when you first take it out of the bag, it's nice and soft. Young people have soft gummy bear lenses. Older people like me have harder ones. That means they won't change shape, and you need glasses to do that, reading glasses or bifocals. So there's the lens. Okay, getting back down inside here, The yellow here is the optic nerve. This is what conducts nerve impulses from the retina out to the brain. Everything here, this kind of a peach tan color, is the retina. That is the layer that actually converts light into X potentials so you can see. And then the reddish structure in here is called the ciliary body or ciliary muscle. That's the muscle that attaches to the lens through what are called suspensory ligaments to help stretch the lens out when you're looking far away, or relax and let the lens fatten up to see something up close. And I believe that is it for the eye. Okay, moving on to the ear. We have lots of these ear models. So it also has a QR code on there, so you should be able to key this pretty easily. I noticed a lot of people like to use my tour as a key, and that's fine as well. But if you want to see it in 3D, you can get it from the QR code. All right, we're going to start with this little structure here. This is called the cochlea and semicircular canal portion of the model. We're going to start at the top. Each one of these things is called a semicircular canal. Each of them has a separate name, but I'm not going to ask you to know those. If you know that any of these are semicircular canals, now what do you guys notice about them? One of them goes this way, one of them goes this way, and the other goes this way. What do you think that means? Why one would go this way, one would go this way, and one would go this way?
Acoustics?
What do you guys remember way back at the beginning, I was teaching you guys about the planes of movement, right? Sagittal plane, transverse plane, and coronal plane. Well, each one of these, when it moves, gives you that sense that you're rotating in that plane. So this one gives you this movement. This one here gives you this movement. And then this one here gives you this movement. Does that make sense? So you can feel all three directions. So these contain a fluid that when your head moves, a little thing called a cupula flexes when the fluid flows past it, so that you can feel the movement of it. Now, will you need to know the function? No, but it might help you remember the name semicircular canals, which means half circle. Okay, the next part right here is called the stapes. The common name for it is stirrup. Which one are you going to put on the test? Stapes. Why? Always scientific term. Okay, and please, Josh, no more abrevs on your lab exam. Okay, full words. And this is really important, guys. If there's no room on the test, hey, I understand there's limited room, right? But if you don't have enough room to write the word, you put a little star and write C over, and you continue on the back, and there'll still be room for your extra credit. Does that make sense? Please don't try to squish it in. If you don't have room to write it normally, just put a star, C over, and then put the number that you're continuing, right? And then continue your answer. It's better than squishing it in. I'm just giving him a hard time. Okay. Next, this is the cochlea. This cochlea comes apart, but you can't really see that much. Anyway, the cochlea here contains several fluid-filled chambers that when sound reaches it, they start to vibrate, and this gives you your ability to hear sound. And this whole nerve here is called the vestibulocochlear nerve. Now notice one part of it has kind of red outlines, and the other is just pure yellow. The one that has the red kind of subdivisions is the cochlear nerve. That's coming from the cochlea, bringing X potentials from the cochlea for sound to your brain. The other one is called the vestibular nerve, and that's bringing signals from the semicircular canal, the saccule utricle. Basically, saccule and utricle all give us a sense of gravity, what's up and down. Now, these semicircular canals are all about movement, right? But the saccule and utricle, which are here, give us our sense of gravity. Let's see, what else do we have here? That's it for this portion of the model. Okay, moving on to the tympanum model. Do you guys know what the common term for the tympanum is?
Eardrum.
Eardrum. Use tympanum on the lab exam. Okay, so we still have two bones remaining that are part of the auditory ossicles. I'm also going to bring those out. I think we have them here. So you can see what they look like inside your head. They're the smallest bones in the body. They're teeny tiny. Okay, so let's continue. This was tympanum. This was the malleus is the one directly attached to the eardrum. And then the incus. Now, incus means anvil, or the common term is anvil. And the reason why they named it that is because the one end of an anvil has this point. You guys ever seen one of those anvils that blacksmiths use? So the malleus or mallet, hammer, and then the incus or anvil. Okay? They all have a function to transmit vibrations from the eardrum to the cochlea so you can hear. All right, so that's this part of it. I don't know if this will be separate, probably not. It will be remaining sitting in here so that you can easily, well, we'll get it back in there somehow. Okay, so what do we have left here? This is the external ear. By the way, most people get that term inner ear mixed up. When they say they have an inner ear infection, nobody gets an inner ear infection. You get a middle ear infection. Everything from your ear tube outward is your external ear. Everything where the bones are is called your middle ear. And then the cochlea is your inner ear. And you don't get infections there. You get infections where the bones are. And why is that? Because that chamber is connected to the outside world via your throat. And you guys ever notice when you go up and down the grade, you have to pop your ears? And the idea is you're trying to, when you stretch your mouth open like that, you're stretching what is called your eustachian tube open. Normally it stays closed to keep bacteria out of your middle ear where the bones are. But when you do that, you open it temporarily, allowing a little air in or out so that the pressure on both sides of the eardrum is equivalent. If the pressure is higher on one side than the other, it won't move freely and you won't hear as well. Now you may have noticed if you don't pop your ears going up or down the grade and then you pop them, you can hear far better than you did before because pressure on one side greater than the other reduces vibration. Okay, so this is called the pharyngo-auditory tube. Pharyngo-auditory tube as in pharynx and auditory, or just the eustachian tube. I'll accept either one. Pharyngo-auditory tube or eustachian tube. Now why do kids get middle ear infections more than adults? Now notice that. What's that?
They're not fully developed.
Not fully developed, but it has to do with the angle. Do you guys see how this is an angle? Children, because of the shape of their head, this pharyngo-auditory tube is horizontal. Mm-hmm. And it's easier for the bacteria to swim horizontally into the middle ear canal. Plus their immune system isn't as fully developed. Mm-hmm. So that is part of the reason. In adults, it's downwardly deflected, inferiorly deflected, as I told you guys about the spinous process of the thoracic vertebrae, right? Okay, so this is the middle ear cavity. This is the pharyngo-auditory tube. This is what is called the external auditory canal or external auditory meatus or external acoustic meatus or external acoustic canal, any combination of those terms. Okay? This is what most people call their ear. The ear is all of this, but this is your pinna or the fleshy part of the ear. The pinna is the outer part of the ear. Now, what is the point of it? Why do we have it? It's not to focus sound waves into your ear. It's to give directionality. And I think I talked a little bit about that in my lecture. The curves and whirls change the sound, giving tiny little micro echoes that give you a term of whether the sound came from above you or below you if it's in the dark, so you know. And I believe that's it for the ear. I will not be asking about the blood vessels. Okay, so that's the ear. All right, nasal stuff. Now I did put on the lab exam the, what was it, the olfactory bulb? Olfactory bulb? Mm-hmm. Okay, so you can see the olfactory bulb is right here. I may ask it again. Olfactory bulb is right here. This is on the underside of the brain. And then down here, what are called the olfactory nerves. These are olfactory nerves coming up from the olfactory epithelium, which is everything being shown in pink along here. Everything pink along here is the olfactory epithelium. And these two structures here and here that seem kind of like, almost like tongues, are called the nasal concha. The nasal concha also contain nerves that move their way up. So anything that's yellow in through here and here is called olfactory nerve. And then the nasal concha, their main job, by the way, is to warm and moisten incoming air so it doesn't end up cold and dry in your lungs, drying it out. So they may have other stuff on the QR code down here, but I don't ask that much from this. So that's pretty much it from this. And what do we have left? Oh, the tongue. Now, as in the past, there's going to be extra credit on this next lab exam. The extra credit is to draw and label, or Blanca wants to, do an image where you label as many structures on the tongue as possible. It's not a lot. If you draw it yourself, you get more points. If you do it from a provided handout, it will be a little bit less. But I may also have other things coming up for extra credit. But for the special senses, I think it's going to be the tongue. Okay? And I believe that's it.